My name's Taylor. I'm going to be your nurse for the day. I just want to introduce myself because I want to talk to you about your heart failure diagnoses and lifestyle modifications that you can change to make heart failure a more manageable disease. Specifically, diet restrictions that you're going to be experiencing. Heart failure is manageable if you do follow these diet and other lifestyle modifications. Heart failure is the wear and tear of your heart over time. If your heart's constantly has an increased workload, then it's going to compensate for a while until it can't compensate anymore. With heart failure, we want to decrease the workload on your heart. And another way that we can do that so that your heart can pump effectively, since when you have heart failure, your heart has problems pumping blood to the rest of your body, more specifically oxygenated blood. If your blood's not getting oxygenated, if your heart's not pumping oxygenated blood to the rest of your body, then you'll start experiencing side effects such as fluid overload. The fluid tends to accumulate like in your extremities, your lower extremities. You might experience edema. You could have fluid accumulation in your lungs where you'll start becoming short of breath. You'll also be very tired. You'll have decreased appetite. And another side effect could be weight gain. If you experience weight gain, more than 3 pounds in one day or more than 5 pounds in 2 days. That's all could be side effects of heart failure. So over time, your heart becomes enlarged and it makes it more difficult for it to pump the blood. With that comes fluid accumulation. A way that you can modify your life by restricting sodium in your diet. Your doctor specifically puts you on 2,000 milligram or less sodium in your diet. I wanted to discuss options with you on sodium restriction, and then hopefully by the end of this discussion you will be able to name at least 2 food groups that can help you stick to a low sodium diet. So that will be our goal for the day. Okay? So I'll go ahead and give you options, how to read food labels, so that by the end of this discussion, you will be able to tell me at least 2 items. Does that sound good to you? Okay. So, one of the ways that you can decrease sodium in your diet is by reading food labels. You're going to want to stick with food items that say less than 140 milligrams per serving. If it says more than 300, it's probably going to be high in sodium, and it's going to be hard to stick to a low sodium diet if you're constantly eating food items with 300 milligrams. And with sodium, if sodium causes fluid retention, so if your heart's already having difficulty pumping the fluid to the rest of your body, and you add more fluids by having high sodium diet, then it's just going to increase the fluid, make it harder to get rid of. So that's another reason. And if you have increased fluid overload from high sodium intake, then it just increases the work demand on your heart, which is not good for heart failure patients. Another thing you can do is check the serving size. So if you pick a food item with 140 milligrams serving, but you eat 3 serving sizes, then you're not sticking to a low sodium diet. So always check your serving size and make sure you're only eating 1 serving. You want to avoid processed food. Processed food is very high in sodium, such as any canned foods or processed food, packaged foods. Those are foods you want to avoid. You also want to, on some food labels, you'll see, will say very low sodium. You want food labels that say no sodium, salt-free or sodium-free. ways that you can enhance your flavor, because a lot of people use salt for flavor on their food, is you can try fresh herbs, or you can try lemon juice or other type of juices, lime juice, fruit juice, stuff like that. Some type of food that you can have are whole grains, dry pastas, oats, fresh fruits. You want to stay with fresh vegetables, not canned. Another high food item is canned soup. So if you're going to have soup, then try to have it homemade. Dairy products. Want to stay away from some dairy products like cheese, fresh fruit or applesauce, or fresh meats. Vanilla wafers you could have. Those are an example of like a dessert item you can have. Foods that we don't recommend are breads or crackers that are topped with additional salt, canned vegetables, sauerkraut and pickled vegetables, processed cheese, and a lot of condiments such as salt, sea salt, ketchup, barbecue sauce. Those are all high in sodium. So, do you have any questions about your 2,000 milligram or 2 gram sodium intake less than that a day? Okay. So, if I were to ask you now 2 food items to avoid, would you be able to tell them to me? Okay, very good. And how about 2 food items that you would like to stay away, or that you would like to have to replace these items that you cannot have? Alright, fresh vegetables or fresh fruit is a very good example. Okay. I think you're ready to start your 2,000 milligram less sodium intake a day.